Welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today on this Health Supplier Segment. Our guest in studio is Dr. Joseph Krainin. He's certified in sleep medicine. Additionally, he's the founder of Singular Sleep. Now, Singular Sleep makes it easy and affordable to order a home sleep apnea test, and patients can also consult with a sleep apnea doctor online. Welcome to Health Professional Radio, Dr. Krainin. Thank you for joining us today. Now, you're the founder of Singular Sleep. Talk about Singular Sleep. How long have you been in business, and why did you start Singular Sleep?
We launched in Veterans Day 2015, and the inception was really me realizing that there had to be a better way. Mm-hmm. There had to be a better way of getting the millions of people who have, as of yet, undiagnosed sleep apnea tested and treated rapidly and more cost-effectively than the current system allows.
Okay. So are we talking about just sleep apnea or a myriad of sleep disorders?
In sleep medicine, the most common thing that we deal with, wherever you are, whatever country you're in, mm-hmm. whatever sort of practice you're in, is sleep apnea. Okay. That is our cross to bear, so to speak. It's the most common clinical problem that we manage. Now, we also deal with restless leg syndrome and insomnia and narcolepsy and parasomnias, but those are much less common. And what I saw in my traditional brick-and-mortar sleep medicine practice is echoed at Singular Sleep. The majority of patients that come to us mm-hmm. seek help with sleep apnea and sleep breathing problems.
Okay. Are there any misconceptions about sleep apnea? We hear a lot about sleep apnea, CPAP machines and whatnot. Clear up maybe the one major misconception that you find yourself faced with whenever you're dealing with a new patient or an existing patient.
That's a great question, Neal, and there are a couple aspects to that I'd like to get into the weeds about a little bit. First would be, who is at risk for sleep apnea? Mm-hmm. Most doctors think that the typical sleep apnea patient is an overweight or obese middle-aged male. Mm-hmm. That is a gross oversimplification and just patently false. Mm. The American Academy of Sleep Medicine estimates that 26% of adults aged 30 to 70 in the U.S. have sleep apnea.
That's huge.
And we are overlooking a lot, humongous numbers, and we are overlooking a lot of people. So, for instance, women may present with symptoms that are not typical, or at least what doctors, primary care doctors think is typical. So women can present with not all that much snoring, but they present with insomnia, trouble staying asleep, and fatigue. That is a very common presentation for premenopausal women. What a lot of doctors don't know is they know that rates of sleep apnea are less in women, but they don't know that rates equilibrate in women after menopause. They catch up to men. Now, elderly people have a very distinct way of presenting. Doctors generally think that sleep quality declines in our elder years, and that is true, but it may not be normal. It may be because of high rates of sleep apnea, and sleep apnea often presents in elderly people with nocturia. That may be the first sign of sleep apnea, excessive urination during the night. Thin people often get overlooked for sleep apnea, even when they keep coming in to their doctor complaining about their sleep. The doctors just look at them and say, yeah, you don't look like you fit the bill. I'm going to give you some Ambien or Trazodone or something like that. But thin people who have certain jaw and airway structures are predisposed to sleep apnea. And those include retrognathia, micrognathia, dolichocephaly, adenoidal facies. And just looking in the airway, looking in the back, if you see a lot of narrowing, what we would call a Malampati 3 or 4 airway, then that person's going to be at high risk no matter what their BMI is. So people need to think about that. Docs need to think about that. But the other thing is what docs need to think about and talk to their patients about are new technologies in diagnosing, managing, and treating sleep apnea. So traditionally, you have had to go into a sleep lab to get a sleep study.
Okay.
Patients don't want to do that. It's expensive. It's a night spent in a foreign environment with a camera on them, people watching them. They may have issues being away from their children or other dependents. A lot of factors can play into people just being resistant to it. But now we can do the studies at home. In 2007, the American Academy of Sleep Medicine came out with a new guideline that said for at-risk patients with high pretest probability of sleep apnea, that an at-home sleep study is equivalent to an in-lab study for the purposes of diagnosis. So a lot easier, a lot more cost-effective. We can send it now. The singular sleep model is we send it to people, ship it to them in their own home. They do it in the comfort of their own home. And I believe that we get more accurate data, because when you bring people into the lab, they don't sleep like normal. And it's not just self-reported. It's actually physiological. There's something that we call the first night effect. People don't sleep as well in a new, novel environment. They often skip their first REM period, which is important because obstructive sleep apnea is typically worse in REM sleep. So we may not be seeing really what's happening on a night-to-night basis with this person. When we do the sleep test at home, much more accurate. We also see people's normal patterns. People are people, and they sometimes drink too much in the evening or smoke cigarettes or do other things that bring out sleep apnea that you're not going to capture in the sleep lab. So for those reasons, it may be a more higher ecological validity test for us. And then the last thing is, how do we manage this more effectively? We tend to tell people, this is a really big problem. You need to get tested. And then they get tested, and then they face a 2 to 3 month, sometimes, wait to see the sleep doctor. Well, that's not appropriate. We can't be convincing people that this is an important problem, and they just have to sit on the results for a long period of time. So at Singular Sleep, we have a new model, a telemedicine model, where I consult with people online. And because of the overhead issues, they're much lower, and the availability of doing it from the comfort of my home office, I can expand the hours and make myself much more available to people. We generally get people in after sleep study within 1 week, and then we can get the ball rolling and get them treated.
So basically, at Singular Sleep, you can address many sleep problems, in addition to the biggest one by far, which is sleep apnea and related problems. This home test, is this something that comes in a huge box, or is it something small like a home drug test? And is there a description of this home test at your website?
Yes. So please go to singularsleep.com for more information. We have a description of the home sleep testing process ad nauseum. We go really into the weeds about it. And then I have a very active blog, and a lot of the articles describe various aspects of sleep apnea, including the treatment options and what the numbers mean on the sleep study, et cetera, et cetera. So a lot of good information in the blog. And the testing kit is quite unobtrusive. It's night and day different from the in-lab sleep study experience. The in-lab sleep study experience, you're going to have electrodes all over your head and face, and then sensors all over the body, really from the top of the head to the legs, all wired up and connected to a jack box that's pretty bulky that you have to unhook should you have to go to the bathroom during the night. Someone has to come in and help you, and it's a really
hassle,
cumbersome process.
Yeah.
And the home sleep test, totally different. very streamlined, very minimalistic. We just get what we need to diagnose the breathing problem. And the majority of units are based on a model where there are essentially 3 to 4 sensors. One sensor is the nasal cannula that goes under your nose. It's basically, it looks like an oxygen cannula that measures airflow. The other really important sensors are the chest belt, which measures respiratory effort quantitatively. We use RIP technology. And then the pulse, this is a quantitative measure of breathing. So when we see chest excursions, we actually can tell how much effort there is in a valid sense, not just a sort of estimation, is there some effort or no effort? This is highly accurate. Yeah. And then the pulse oximeter measures oxygen saturation. Now, the brains of the unit sit on the chest belt and weighs about 2 to 3 ounces, a little plastic case. And in that body, there is a chip that measures, that records the data, and also the unit that we use measures body position, which is important because body position can be a big influence on sleep apnea. Some people have sleep apnea just when they're on their backs, and for them, maybe the solution is just stay off your back. But we want to know about that, and we also want to make sure they got enough back time, because if they just slept on their stomach and they were just under the limit of meeting the AHI of 5 criteria for sleep apnea diagnosis, then maybe we didn't get such an accurate study. So we want to know about body positions. It's important.
And all of this information can be easily gathered right there in the comfort of your own home through Singular Sleep. It's been a pleasure talking with you today, Dr. Krainin. Thank you for coming on.
It's been wonderful. Thanks for having me on, Neal.
Once again, the website is singularsleep.com. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Joseph Krainin, founder of Singular Sleep. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.